is Delhi-NCR once again witnessing a surge in the viral fever, in dengue cases and swine flu cases. Though the MCD, which was supposed to release the data on dengue fever, has not really released the data in last 1 month. So what is really the situation on ground? Are hospitals really filled with patients as far as dengue and swine flu cases are concerned? We are at Max Hospital and you can see this is the OPD where there are in fact patients who have come in large number. But what is really the situation? Is it because of the viral fever that is doing the rounds? Is it because of dengue, swine flu? To know more about it and to know what are the precautions and what are the symptoms that one can actually look for and differentiate between them. Because when it comes to viral fever, when it comes to swine flu and dengue, the symptoms are all the same. So how does one differentiate what he or she is suffering from? All those details we'll be getting from the experts and doctors that we'll be speaking today. To know what is really the situation on ground when it comes to dengue, when it comes to viral fever or swine flu, to talk more about it, we are in fact joined by Dr. Sandeep Buddhiraja, who is the Group Medical Director of Max Hospital. So thank you for speaking with us. There is a lot of cases. Is there actually a lot of cases? Because for past 1 month, we have seen that the MCD has not released the data on dengue. So we don't really know if there is a upsurge or increase in cases. But you being a doctor, do you think on ground there is an increase in dengue or is it viral fever?
So, yes, we are seeing both dengue fevers and different types of viral fevers. But let me tell you, this is nothing unusual this year. This is normally the trend of these illnesses, viral illnesses we see every year around this time post-monsoon. More so, especially as the temperature comes down, humidity increases, and there's an intermittent rainfall. That's actually the ideal environmental situation for the mosquito to sort of, increase in numbers. And automatically this correlates with increased number of dengue cases coming in. We've been seeing it really for last so many years now. So what I would say is that it peaked around a week, 10 days, 2 weeks back. After that, the number of dengue cases has sort of plateaued out. I won't say that they have been persistently increasing. So they have sort of plateaued out. And overall illness continues to be mild. And a large majority of patients are able to be managed at home. Of course, we do tell people that at this time of the year, if you have any sort of fever, don't take it lightly and get in touch with your doctors. As far as the other types of viral fevers are concerned, there's again in northern hemisphere, in northern India, especially in Delhi and areas around it, we typically see 2 peaks of flu or influenza. One is this time post-monsoon, and second is so January, February. So these are the 2 spikes. And consistent with that first spike post-monsoon, we are seeing increased number of cases. So typically this time we are seeing people presenting with a short history of very high fever, body aches, cough, cold, runny nose. So that's typically flu or influenza A-like symptoms. Some of these cases are swine flu also. But again, most of these are very short illnesses, 3 to 5 days, and people generally recover on their own. Important thing is only symptomatic treatment is required, and one should not really use antibiotics for these viral illnesses. It only promotes resistance to antibiotics and doesn't do anything more than that.
So say for example, if someone is suffering from high fever, headache and those symptoms, how does one determine whether it is dengue, swine flu or if it is a viral fever? Because I believe swine flu has a separate test altogether, so does dengue.
Yeah. So actually that's very important thing to be aware of. All these are viral illnesses, including dengue is also a viral illness. In flu-like illnesses or in flu, whether that's influenza A or swine flu or for that reason even COVID, all these will manifest with symptoms of fever and headache and body aches, which are common symptoms. Yes. But specifically one would have cough, cold and runny nose. So presence of cough, cold and runny nose or throat pain are symptoms which are attributable to upper respiratory system involvement, and these will typically be seen in influenza, flu, swine flu, COVID. In dengue fever, you generally do not have these cough, cold, throat, runny nose symptoms. What you have is very high fever, extreme body aches, severe headache, and then it goes through various phases. Then you start noticing a very subtle pinkish rash on the body which blanches on touching. And about in dengue, if you are talking about on the 4th, 5th day, after the 5th day, the fever settles down. But actually the days 6, 7 and 8, if you ask me, are the most crucial and critical days in dengue. Patient feels my fever is gone, so I'm fine. But that's actually the time when not only the platelets start to go down, but the blood tends to get thicker, which is a more important parameter. So there's a parameter in the blood counts. We are generally focusing only on the platelet counts. But what we should focus on more at this stage is the packed cell volume or the hematocrit and the hemoglobin, which tends to go up at this stage, which means that your blood is getting thicker because the liquid component of the blood, the yellow component which we call plasma, leaks inside the body only. And this sort of relative dehydration within the body then leads to organ failures. So the only precaution or the most important precaution one needs to take in any of these illnesses is to keep yourself well hydrated. Drink a lot of water, whether it's flu or whether it is dengue, and more so with dengue, at least drink 3 to 4 liters of water. Now, if you have abdominal pain, if you are retching and nauseated and vomiting, then obviously you can't retain. And then that forms an indication for coming to hospital for taking intravenous fluids, even if your platelet counts are fine. So don't worry about that, but most importantly, make sure that you are very, very well hydrated. And other than that, take simple paracetamol for body aches, fever, headache. Do not take any strong painkillers.
Also, I want to ask you that there are in fact reports of a new strain of dengue, D2 strain. Is this a new strain? What do we know about this, and how is this different from the existing dengue?
No, it's not a new strain at all. We know of 4 types of dengue strains: dengue type 1, type 2, type 3 and type 4. In fact, type 1 and type 2 are the commonest type of dengue strains which we have been seeing over the years. There are subtle differences in the terms that all 4 dengue strains will cause same types of illness, but conventionally type 1 is associated with a slightly milder illness, and type 2 can sometimes be associated, especially in vulnerable population, elderly population, a more severe form of dengue disease. But in terms of clinical decision making, clinical treatment, or for an individual patient, I don't think these types make any difference. But why these are important epidemiologically is because when you get dengue with one of these strains. So then you get a long-term immunity against that particular strain. But that doesn't mean that you can't get dengue again, because dengue, just as I said, there are 4 strains. So it may be possible that this year you come down with a dengue of type 1 strain, but again after a year or 2 you get a dengue and this is of a different strain. So normally people say once you get an illness you don't get it ever again because you get resistance. That doesn't happen in dengue because of multiple strains. And also sometimes it is seen that the 2nd or 3rd episode of dengue can actually be more severe than the dengue the first time you get it. So to answer your question, this time the serotyping which is being done for the cases has shown majority of cases, at least 60% plus cases having type 2 strain. We do see type 1 and type 4 also, and sometimes a mixture, but predominant this year so far has been type 2.
Are the treatments and symptoms different for type 2 or D2 strain?
No, just as I said, the constitutional symptoms like fever, headache, body aches remain the same. Abdominal discomfort, rashes, all those things remain the same. But type 2 may be associated with sometimes more complications, especially in people who are vulnerable or who have sort of delayed their treatment. So it can lead to dengue shock syndrome, dengue hemorrhagic fevers, which can happen with any type, but sometimes seen more often with this type.
Can we say D2 is more fatal or just with comorbidities?
I wouldn't say it is more fatal. See, the thing is that if complications happen in dengue and they are not addressed in time, irrespective of whichever strain of dengue it has caused, it can be fatal. If you detect it timely and you start treatment in time, you can save most of these patients. But yes, the chances of complications may be more in type 2.
So that was Dr. Sandeep Buddhiraja answering all the questions regarding dengue, viral fever, swine flu that is doing the rounds at the moment. Another concern among the rising cases of dengue and viral fever is the outcome of the sero survey that was done in Gurgaon among the dengue patients that has shown that there is a new strain of dengue known as D2 strain. Now, what exactly is this strain? Is it really new or is it an existing one? And how is it actually different from the existing one? What are the precautions and symptoms? We spoke to Dr. Sandeep Buddhiraja, who in fact told us how this is not a new strain but already an existing one, but it is more effective than already existing strains. Like there are 4 types of strains: type 1, type 2, type 3, type 4, and type 2 is considered to be more fatal among the comorbidity patients. So this is what Dr. Sandeep Budiraja had to say more about this D2 strain.